Imagine a dental tool that flushes into your mouth, slaughters the bacteria, speeds up your healing, totally numbs your pain, and then just vanishes.
Right, literally into thin air, leaving zero chemicals behind.
Exactly. So today we are doing a deep dive into triatomic oxygen or, ozone water therapy.
Yeah, specifically looking at how technologies like Aqualab and AQUAZONE are really shifting both clinical dentistry and our oral hygiene at home.
It sounds a bit like science fiction, honestly, like a smart, eco-friendly cleaner that does all the heavy lifting and then disappears.
It does, but it is pure chemistry. I mean, to understand why it works, you have to look at ozone itself.
Okay, so break that down for us.
Well, regular oxygen, the stuff you breathe, is O2. Two oxygen atoms, think of them like a really highly stable couple on a dance floor.
Right.
But ozone is O3. It's a group of three.
Oh, okay, so one of those atoms is basically the ultimate third wheel.
Precisely. And that third wheel is incredibly unstable. I mean, it desperately wants to find a new partner.
So it's looking for something to latch onto.
Right. So when ozone water is sprayed into a wound or onto plaque, that third oxygen atom acts like a microscopic grenade.
Wow.
It forcefully steals an electron from the cell wall of a bacteria or a virus, literally ripping a hole in it and destroying the pathogen.
That's insane. So that's what dentists mean when they call it a powerful oxidant.
Exactly. It just tears the bacteria apart to stabilize itself.
That makes perfect sense.
Yes.
But looking at the clinical data, it's doing way more than just, going on microscopic wrecking spree.
Oh, absolutely. It's reducing inflammation, stimulating blood flow, and acting as an analgesic, so it actually relieves pain in the process.
Which explains why professional dentists consider it such a critical aid for conventional treatments, especially for post-surgical healing.
Yeah, the clinical perspective on long-term oral hygiene success has really shifted because of this.
The notes from the sources are pretty striking, actually. Dr. Vivian Vrata mentions that using ozone has visibly improved wound healing for her patients.
Yes, and Dr. Majdalmasio noted that patients are experiencing zero pain after tooth extractions, just entirely painless recoveries.
But wait, hold on. I need to push back here for a second.
Sure.
You just said this stuff acts like a microscopic grenade that shreds cell walls.
I did, yeah.
So if I'm using a home device, like the portable AquaZone P that the clinics recommend, and shooting this into my gums every day, why isn't it shredding my healthy tissue? Is it really safe for a family to use?
That is the most crucial question. And it comes down to cellular defense.
Okay.
Human cells have very specific antioxidant enzymes. So when that extra oxygen atom comes flying at them, those enzymes easily neutralize it.
I see.
But bacteria and viruses, they lack those complex defenses, so your healthy tissue is perfectly safe while the pathogens just get destroyed.
Okay, so it's targeted destruction based purely on what the cell can biologically handle.
That's the beauty of it, and it's why it's so safe for households. If you look at an easy comparison chart of the product features, the heavy-duty clinic model, the AquaZone, handles the deep surgical cleaning.
Right, the big machine.
Yeah. But the portable AquaZone P scales that exact same ozone generation down for your bathroom counter.
Which seems incredibly useful if you have serious dental hardware. Braces, implants, crowns, bridges.
Oh, absolutely. Those things are absolute magnets for trapping plaque.
Right, and traditional chemical mouthwashes can only do so much, right, without causing irritation.
Exactly. Plus, it's so simple to integrate into your daily routine. You just use it like a normal water flosser. And consider the safety protocol and the life cycle of ozone. After that third atom does its job and destroys the bacteria, what are you left with?
Let me guess, O2. Just the original stable couple.
Yeah.
Pure oxygen.
Yes. It reverts back to pure oxygen and water. There is zero toxic residue left in your mouth.
That's amazing.
And there are absolutely no harsh synthetic chemicals getting flushed down the sink into the ecosystem. The environmental benefits are massive.
So you get an intense clean without the environmental footprint. I mean, between the deep cleaning, reducing inflammation, fighting bad breath at the source, there are like 18 distinct clinical benefits noted across the research.
It really boils down to a fundamentally different patient experience. Yeah. One patient summed it up simply, saying, cleaner, fresher, better, the best dental visit I've ever had.
It really shifts our baseline expectations for healthcare.
It does. And there's one more layer to this I want you to think about.
Oh, what's that?
We know this oxidation process is highly effective at tearing apart the protective fatty outer layers, what scientists call lipid envelopes, of serious viruses.
Wait, including things like SARS-CoV-2?
Including SARS-CoV-2, because, again, they don't have the enzyme defenses our human cells have.
Right.
And it is equally efficient against antibiotic-resistant strains of bacteria, all while leaving zero chemical footprint.
Wow.
So, given all that, could a simple three-atom molecule eventually replace traditional synthetic antibiotics in our daily healthcare routines?
That is wild. From a vanishing smart cleaner in your mouth and a potential answer for global antibiotic resistance, that is definitely something to chew on. Until next time.